Good evening, everyone. Welcome back to Brain Academy. Welcome back. I'm happy to have you all here. So tonight we're going to discuss on something very important, which is what oxygen administration. We're going to discuss something very important, which is what oxygen administration. So if you've not subscribed, do where to subscribe so that you get notified whenever we go live. So firstly, we'll acknowledge God. In the academy, we always acknowledge God and give him all praise for everything he is doing. Now we'll quickly dive into this. I want you all to write, and after tonight's class, you will not forget oxygen administration again. Now let us dive into it. So oxygen administration or oxygen therapy is the administration of oxygen to maintain adequate tissue oxygenation in patients with respiratory compromise. So these are not questions. The device that opens and closes oxygen flow is the A, the flow meter, B, the valve, C, the regulator, D, the gauge. So the right answer is what? If you choose flow meter, you are wrong. If you choose the regulator, you are wrong. If you choose the gauge, you are wrong. The answer is what? The cylinder valve. The cylinder valve. It opens and closes oxygen flow. Number two, the humidifier contains A, tap water, B, sterile water, C, alcohol, D, saline water. So the humidifier contains what? A, tap water, B, sterile water, C, alcohol, D, saline water. So if you choose alcohol, you are wrong. If you choose tap water, you are wrong. The right answer is what? Sterile water. Number three, the safest position for a patient on oxygen therapy is A, prone, B, supine flat, D, semi-Fowler's, and D, Tredelenburg. So if you choose D, you are wrong. If you choose A, you are wrong. If you choose C, you are correct. So the best and the safest, not that in our first class, I saw many students choosing supine. Not that you cannot choose supine, but the safest position to place a patient undergoing oxygen therapy is what? Semi-Fowler's position for your OSCE. That is why I am asking this question so that you, in case anyone you fail, you will note it. So during your OSCE, you can say it and get your mark. So number one thing you are learning in the academy is that we use sterile water for the humidifying cup. We place the person in a semi-Fowler's position. The valve is used for open and closing of the oxygen cylinder. Now, the device used to control oxygen flow rate is A, the regulator, B, the flow meter, C, the pressure gauge, D, the humidifying cup. So if you choose the humidifying cup, you are wrong. If you choose pressure gauge, you are wrong. If you choose regulator, you are wrong. So the answer is what? The flow meters. Are we together? So normal oxygen flow rate for adult via nasal cannula is A, 10 to 15 liter per minute, B, 2 to 5 liter per minute, C, 1 to 2 liter per minute. So send me the answer. I'll drop the answer for this in the comment section. So quickly, I want us to be fast and direct. But before that, make sure you have many students don't get notified when we go live. And I and my team, we are planning a class, Study with Nurse Brainy, where we'll answer short bet questions. So if you've not subscribed, do where to subscribe so that you get notified during the day when we go live on these classes. So notify me. Can you hear me? I believe you all can hear me. So I will continue. So this is the oxygen cylinder. This is the oxygen cylinder. And in some cases, for your Viva, you'll be given this to identify the parts of this to identify. So for being in this academy, you should have the ability and capability to identify this without stress. That is why I'm making this class without stress. Because for your OSCE, you need to identify, at least identify the oxygen cylinder before you go into your OSCE practical. All right. So we will learn this perfectly so that before you greet your examiner, good morning, ma, good morning, sir. I'm here to carry out oxygen administration to Mr. To the patient, Mr. Jones. So before you go in, you first of all gather your equipment, wash your hands, dry your hands, check doctor's prescription. Then to your examiner, you have to identify these parts where we have the flow meter, we have the flow adjuster, we have the NASA prongs, we have the O-ring washer, we have the pressure gauge, we have the cylinder valve, we have the cylinder key, we have the oxygen cylinder as a whole, we have the humidifying cup or humidifying bottle, we have the regulator. So should at least identify this before going into your OSCE. Now, we'll be having an OSCE class and I'll be teaching you the easiest way to pass OSCE. OSCE is one of the most simplest exams, and I will call it not the Nosbury shortcut is the ABC formula. So whenever you use your ABC formula, you are passed. And whenever you enter the exam hall with the ABC formula, I'm going to be giving you now future classes on bed making, cardiac bed, and all those things. Whenever you use the ABC formula, you will surely pass. It is a simplified shortcut, Nosbury shortcut to passing any OSCE. Are we together? So, but today is just an I want to identify this. We want to know this. So quickly, the oxygen, this is the oxygen cylinder you identify to your examiner. This is the oxygen cylinder that houses the oxygen. This is the cylinder valve. So whenever you hear the word valve, it just like the valves in the heart, whenever they open, we have the tricuspid valve, we have the bicuspid valve in the heart. Whenever the valves open, there is influx of blood from one chamber to another. And whenever it closes, there is no influx of blood. In that same way, remember Nosbury used the valves of the heart to explain the cylinder valve. In that same way, the cylinder valve is there to do what? To either open or close. So when, just like the valves of the heart, when the valves of the heart are open, blood passes from one chamber to another. When it is closed, no blood is passing, so that the other will refill. In that same way, cylinder valve, when it is open, oxygen flows out to the patient. When it is closed, the oxygen remain intact. So for being in this academy tonight class, you have noted that the cylinder valve helps to do what? Open and close the cylinder to either allow flow of oxygen out of the cylinder or to close it when there is no patient to administer the oxygen to. Please, can you hear me? Can you hear me? And are you following what I am explaining tonight? So I don't want you to ever forget whenever you hear cylinder valve. Cylinder valve, remember the tricuspid valve, the bicuspid valve, the pulmonary valve, the aortic valve, which either opens and or closes when there is blood flow from one chamber to another. So the cylinder valve works in that same way, allows oxygen to flow out of the cylinder to the patient, or it is locked so that it won't waste. It will remain in the oxygen cylinder. So there is something you can't just sometimes it's not easy to use your hand to open or close it. So we use a key known as a spanner. We use spanner to do what? Open and close it. So what we use to open and close it is the what? The cylinder key, which is a spanner. Are we together? So we lock the teeth of the spanner to the cylinder valve and we tune it to open it or tune it to close it. Having noted this, we've noted three things this night. Number one, the oxygen cylinder. Number two, the cylinder key, which is the spanner. Number three, the cylinder valve. Valves, open and close. Valves, open and close. Write it down. Valves, open and close, just like the heart valves. The valves in the heart. In that same way, we have cylinder valve, open and close. When it is open, oxygen flows. When it is closed, oxygen does not flow anywhere. It remains in the cylinder. So having noted this, we've noted these three parts. I don't want you to ever forget it. We have the what? The pressure gauge. Many students intertwine this pressure gauge with flow meter. Now, this pressure gauge, from the word pressure gauge, Nosbrain said it is gauging something. And to gauge something is to gauge something, to know if it is there's something there or not. That is what we mean by gauge, to gauge something. So whenever you are in the exam and you want to remember this that looks like a watch, we call it what? The pressure what? Gauge. It helps to gauge if there is still oxygen inside the cylinder or not. So when there is oxygen inside the cylinder, the pressure gauge will be leading. When it is full, it will tell you that the oxygen cylinder is full. When it is empty, it will tell you it is empty. When it is half, it will show you that it is half. So we note that by looking at the what? Pressure gauge. It tells us the amount of oxygen inside the oxygen cylinder. Are we together? So we have the O-ring washer. It helps to prevent leakage of oxygen out of this. It helps to prevent leakage. Now we have the regulator. From the word regulator, what is it regulating? It is regulating the pressure. Another name for pressure is what? Force. It is regulating the what? Pressure. It helps to do what? Reduce high pressure that will be leaving this oxygen cylinder, because gas is too mobile, so it flows in full speed. But the regulator helps to do what? Regulate it, to prevent what? High pressure from flowing from this oxygen gas to the patient. Because when there is high pressure flowing from this oxygen gas to the patient, the patient can experience barotrauma, injury to the nostrils, injury to the lungs, nasal trauma, collapse of the alveoli in some cases. So the regulator helps to what? Regulate it. Nurses and midwives, I want you to note this. Don't forget it. It's not something to forget. It is as simple as this. Regulator regulates pressure. It helps to reduce high pressure to normal pressure the patient can accept. Then the humidifying cup, the humidifying bottle or the humidifying cup contains not pure water, not tap water, not anyhow water, but what? Sterile water or distilled water. And the humidifying cup helps to do what? To moisten the air, to avoid dry air from reaching to the patient, because putting that nasal prong into the nose, sometimes it is very uncomfortable for the patient. So, but with the help of the humidifier, it helps to what? Humidify the air, so that the oxygen that is leaving this gas, this dry oxygen that is leaving the gas, will mix with the sterile water and soften the oxygen, so that it will not cause trauma to the nostrils of that patient. Now this is the face mask. Now this one is the nasal prong, otherwise known as the cannulas. So whenever, for being in this academy, whenever you see this in the hospital, don't just call it a pipe. You call it what? Nasal prongs. You speak with intellect, and they will know truly you went to school. Are we together? So when you see this you call it nasal prong. Get that nasal prong and apply it and put it on that patient. During your OSCE, you say, I get the nasal lung, I connect it with the oxygen tube connected to the oxygen outlet of the oxygen cylinder. The examiner will must surely give you mark, because he or she knows you know what you are doing. Now, finally, we have the flow meter. So whenever you hear the word flow, let us spell the word flow. Flow meter. Flow. So FL. So whenever you see that word flow, the L there stands for liter per minute, using Nosbrain shortcut. So flow meter. Flow meter. You are looking at it. You are trying to remember what Nosbrain is saying. you remember the spelling, which is what? FLOW. So the L there, you bring it down in your note and write, you circle it L, and you bring it down and write liter per minute, M for minute, liter per minute. So flow meter for Nosbury shortcut, you bring it down L/M, which is liter per minute, helps to identify the amount of liters of oxygen that is entering the patient per minute, just as how we have the word heart rate, which shows the beat, the how the heart is beating in each minute. So the flow meter helps to what? Identify the or regulate, it helps to identify the amount or liter of oxygen that is flowing to the patient per minute. So for Nosbury shortcut, you circle this L, bring it down, circle this M, bring it down, liter per minute. Don't forget it is different from regulator. Regulator regulates from the word regulator. Let's spell REGU. So we take the word R. So let us spell the word pressure. PRESSURE. So we take the word pressure R. For regulator, we take R. Pressure, we take R. So regulator, REGU. So we circle the word R. We write pressure under. We circle PR. We circle R. So whenever you see regulator, the first thing you should remember is what Nosbury said is what? Pressure. Whenever you see flow meter, we remember our Nosbury short called liter per minute. So the flow adjuster helps to what? Adjust this flow meter. Then this is the oxygen outlet where the oxygen tubing is connected to it. Please, I believe you all understood this class. Please notify me, did you understand this class? I wanted us to dive into our OSCE, but we will not again. So notify me, did you understand everything taught in this class, in this identification? Send your message to me. Did you understand it? This is the flow meter. We can identify it. I'm impressed. Someone said, well understood, sir. I'm impressed. I'm impressed. God bless you. I'm impressed. It shows you are truly following. So whenever while we are doing this class live, one of the sole reason why we're doing this live is to get your interactions, because in our Telegram group, there is no much interaction there. It is locked. That's why we are doing it live, to get your interactions. Now, like I earlier said, some students don't get notified when we go live. So if you've not hit the notification bell or the subscribe button, please do, so that you get notified. Because I and my team, we are planning a class especially for the upcoming students, so that we can answer questions like show bets together with the rationales. We will explain the rationales for you. So whenever you are giving this, please don't forget it again. Looking at this, can you identify this? We have the flow meter. We have the flow meter, liter per minute, shows the for Nosbury shortcut flow meter. We have the pressure gauge, pressure gauge showing the pressure inside the oxygen cylinder, the pressure gauge, whether there is still oxygen at all or not. So if there is low oxygen, if there is no oxygen, it will be in 0. If it is filled up, it will be in 100. If it is half, it will be in 50. It can be in any number. It will tell you whether you should fill it or not, whether it will be enough for the patient or not. So it is this pressure gauge. Why the regulator is what? Regulating the high pressure, because once you on this valve, once you on the valve, the pressure will get high. So the regulator will help to what? Regulate this pressure. Then we have the humidifying cup that contains not tap water, not pure water, in case you are working in the hospital. That is why we are teaching, there is a new addendum called quality improvement. So to improve the amount of quality a nurse or a midwife should give to the patient. So for being in this academy, you should note that give we don't put tap water or ordinary water into the humidifying cup, but sterile water or distilled water into the humidifying cup. And the work of the humidifying cup is to moisten the oxygen to prevent it from being dry, to avoid nasal trauma to the patient. This is the oxygen outlet. This is the oxygen outlet where this cannula is being inserted to. This is the flow adjuster. Adjust the amount of flow. If it is a child, there is the amount of flow for children in liter per minute. If it's an adult, there's amount of flow liter per minute. So we use the flow adjuster to adjust this flow rate. Then for the OSCE, quickly you greet your patient, you greet your examiner. Good morning, ma. Like I said, I will still give you shortcut for this and we'll do a better class, a video class, so that you can see the practice visually. So you greet your examiner. Good morning, ma. Good morning, sir. My name is Nurse Brainy. My exam number, not your reg number. My exam number is this or that. So you first of all, after identifying, you quickly, as fast, make it snappy, identify the parts of your oxygen cylinder. Then you do what? You wash your hands. You introduce yourself to your patient. Good morning, Mr. Jones. My name is this, Nurse Brainy. I'm here to carry out oxygen administration to you. Should I go on? That is seeking consent. You tell your patient, I have seek consent and I will maintain privacy. All these things are marked. So after that, you quickly check the prescription on the doctor's prescription on the folder. You say it and you act it. I will check the prescription on the patient's folder and I will assess the patient. If it is breathing very well, check vital signs. That you will say it because of time, you won't act it because you are here to do oxygen administration. So you position the patient, and like I said, you can leave the person in a supine position, but the safest, most accountable and approved position is what? Fowler's position. You place the person in a semi-fowler position, you check for no stress, then you clean with normal saline. Some school of thought will tell you clean with sodium bicarbonate, but the best approved uh, instrument for cleaning is what? The normal saline. We clean what? Normal saline, and check patency of the no stress. After that, you connect your oxygen. You set the flow rate using the flow adjuster. If it is a child, you know the flow rate for the children. If it's an adult, you set the flow rate for the adult. Then you check bubbling to know if there is no bubbling. When you put it in something, a water, and there is no bubbling, it shows that no oxygen is flowing out of it. So the bubbling we identify, there is an oxygen inside this, and it is truly connected to the oxygen outlet. So the oxygen is flowing very well. So you apply the NASA prongs. In this academy, you already know what is NASA prong. Then you monitor patients, you educate patients, you report. Very important, you document. This has its own mark. You maintain hand hygiene. You wash your hands, you tidy up. Are we together? I believe you learned something in this class. I believe you learned something. So let us quickly identify this one more time and we call it a day. Let us identify this one more time and we call it a day. I'm impressed. Well explained. Many students, God bless you. I'm impressed. I'm impressed. So, number one question, the device that opens and closes oxygen flow. Remember Nurse Brainy shortcut? The heart closes and open. The valve of the heart closes and open. The valve of the heart closes and open. When it opens, blood flows in. When it closes, there will be no more flow of blood so that the ventricles will refill. So what is the answer? The device that opens and closes oxygen flow is the A, flow meter. Remember Nosbury shortcut. The valve of the heart. B, valve. C, regulator. D, gauge. What is the answer? So if you choose D, you are wrong. If you choose A, you are wrong. If you choose C, you are wrong. If you choose B, you are correct. The valve of the oxygen cylinder, called the cylinder valve, used to open and close. Using what? What is the key? The spanner, the cylinder key. I want you, for being in this academy, when you work in the hospital, you are different. People will wonder, where are you coming from? You will tell them you're a student of Nurse Brainy by God's grace. Are we together? So you are able to identify everything. Once you see a nurse putting water into the humidifying cup, you tell them no. As a quality improvement nurse, it is not right to put ordinary water or tap water. What we use is sterile water or distilled water. They will wonder and they will know truly you are a quality student. When a patient is feeling discomfort, that the pressure is too much, what are you going to adjust? The regulator. You use the regulator and adjust it because to reduce the pressure. Now, number 2 question, the oxygen humidifier contains A, tap water, B, sterile water, C, alcohol, D, saline water. What is the right answer? So if you choose saline water, you are wrong. If you choose alcohol, you are wrong. If you choose tap water, you are wrong. So the right answer is what? Sterile water. Sterile water is the right answer that will be put in the humidifying cup. And the function of the humidifier is to, normally oxygen is dry. So the humidifier will help to soften that oxygen so that when it is flowing to the patient nose, and sometimes this water do dry out. So as a nurse or a midwife, you constantly check this when a patient is in a long-term oxygen administration to prevent causing nasal trauma to the patient. Are we together? I'm happy many students are notifying me that they're enjoying the class and are learning a lot. And I'm impressed and I give God Almighty all the praise. You must surely pass your exams. So after this class, notify me the next class we are going to do, because I am going to follow you back to make sure you succeed, and you will succeed. So number 3, the safest position for a patient on oxygen therapy is A, prone, B, supine flat, D, semi-Fowler's, and D, Treadledenburg. I believe you all know your positioning. I will still make a class on that. Now, if you choose D, you are wrong. If you choose prone, you are wrong. If you choose supine flat, you are 75% wrong. The answer is what? Semi-Fowler. Semi-Fowler is the safest position. You can put the person can be in supine, but the best position to allow the inflation and deflation of the lungs, and to allow patency of the bronchus, to allow patency of the nasals, the nostrils, to allow perfect oxygen therapy. The best position you are going to put your patient is what? Semi-Fowler's position, which you will say in your OSCE. The next and finally, the device used to control oxygen flow rate. Whenever you see the word flow rate, you should know what we're talking about. A, regulator, B, flow meter, C, pressure gauge, and D, the valve. So what will be the right answer? The device used to control oxygen flow rate. Remember our Nosbury shortcut, LM. So we have what? A, regulator, B, flow meter, C, pressure gauge, and D, the valve. So if you choose valve used to control oxygen flow rate, you are wrong. If you choose pressure gauge, you are wrong. If you choose flow meter, you are correct. Now, this is the oxygen cylinder. This is the key, the spanner. This is the cylinder, the valve. Look at it. The valve, you open it here. or you close it. If you close it, no more oxygen will come out. If you open it, oxygen will flow. Pressure gauge shows the pressure inside it, shows if it is full, filled up or not. If it is half, it will show by its reading. If it is empty, it will read 0. If it is a little bit filled, 20, 75. It is 100% filled to read 100, showing that it is filled up. The regulator regulates the pressure leaving this oxygen cylinder. The O-ring washer prevents leakage of this oxygen, leakage when flowing. The face mask, this is face mask, we put it as face mask. Why this is cannula, this is NASA prongs that is being inserted into the nostrils. Then this is flow meter from our nose brain shortcut. We are writing our notes FLOWM. So we take L, we circle L, and we circle M. So liter per minute, liter per minute, nose brain shortcut, simplified way of learning, liter per minute. So whenever you see flow meter, if it is an adult, children has their own liter per minute flow, adults have their own liter per minute flow. So this is the flow adjuster used to adjust this either for children or for adults. This is the humidifying cup that contains sterile water to moisten the air. This is the regulator that regulates the pressure leaving the oxygen cylinder. So if you learn something, send me your reviews online. If you've not subscribed to follow our Study with Nurse Brainy class, please make sure you subscribe so you get notified, and also hit the notification bell so you will get notified when we come live. So God bless you. God bless you. God bless you. Nurse Brainy loves you and prays for you, and pray you will pass, and you will surely pass. God bless you. So send me reviews on WhatsApp. If you're not in the WhatsApp group, notify me. I'll add you to the WhatsApp group. God bless you.